Good morning, good afternoon, good evening to you, depending on wherever you're joining us from. The International Society of Substance Use Professionals Kenya chapter is delighted and honored to host this October's webinar on Who Helps the Helper, a skills transfer program for behavioral and substance use professionals. My name is Martin Cairo, a certified addiction professional and member of the Kenya chapter of ISSUP, and I'm honored to be your moderator during this webinar. ISSUP is an international membership organization that is focused on the development, support, and representation of a professional workforce within the field of substance use prevention, treatment, and recovery support. We address our mission by sharing the latest evidence-based, ethical, quality information, and promoting opportunities for professional development, connection with other professionals, and doing so across borders and across professional fields nationally, and internationally. ISSUP Kenya is the local chapter and works to meet the needs of our members locally. We do this by hosting webinars such as this, which enable us to increase reach, training, knowledge sharing, and networking opportunities. As always, we encourage those of us who have not yet done so to consider joining your local chapter of ISSUP for information, networking, and training in drug demand reduction matters. Before I formally introduce our speaker, a few housekeeping announcements. One, a reminder that this webinar is being recorded, and the recording and the slides with the content of today's webinar will be available in a day or two on our issup.net website. Second is that there are certificates of attendance that will be emailed to all those who are registered via their go-to registration page with the email you used to register for this webinar. And third, please write in any questions you may have on the question or chat box in your control panel. I will collate them and present them to Lambert at the end of the presentation. Please note that this webinar is provided for informational purposes only and does not constitute medical or treatment advice. The views presented here are those of the speaker and not necessarily those of ISSUP. Our esteemed speaker today is Mr. Lambert Oigara, who is a clinical psychologist with 20 years experience in the field of mental health. He has worked in clinical setups with children, adolescents, and adults. He is a co-founder of CBT Kenya, a community behavioral health counseling center in Nairobi. Lambert is an executive member of ISSUP Kenya, a member of the Kenya Counseling and Psychological Association, KCPA, and the Kenya Psychiatric Association, KPA. Welcome, Lambert.
Thank you very much, Martin, for that introduction. Thank you all for taking time to attend this webinar titled Who Helps the Helper. Before I get into my presentation, I'd like to maybe just take time and talk about myself, because as a helper, we find that the nature of work that we engage in revolves around listening, and most importantly, active listening. And the reality about this is that sometimes we get very much absorbed in what we like doing, and we can easily forget ourselves. Now, allow me to share. About 10 years ago, I was employed and actively involved in my job. And the reality is that one day I woke up and I said, I'm not going back to work. And that is how, looking back, I can confidently say that I was burnt out. And that period took me to a space where I engaged in an area that I blessed in, which is art. and we ventured into the creative world for some time. And due to the support from friends, families, colleagues, I was able to get out of that space of burnout. And the rest is history. The truth of the matter is that burnout is insidious. It moves slowly, and slowly. It can actually get you to a not so very good place. So therefore, as we go through the journey trying to answer the question, who helps the helper, it is important for us to also appreciate, as professionals, we need to think of programs that are evidence-based, that can take us to that space where we can be able to not only support those we are committed to helping, but we are able to support ourselves and those who are coming after us. Of course, in this presentation, this is the outline. Look in perspective, and I will delve deeper into the program called the Skill Transfer Program, and finally, call to action, conclusion. I've of course told you about my story and how I changed my career. And for sure, when you look at the definition of burnout, we're able to appreciate that it's a chronic condition that results as challenge while you're at your place of work. And you might not see it, other people might see it, but the most challenging thing is that you'll keep going and you probably feel exhausted, but you'll keep going. And this will increase mental disturbances or distancing yourself from one's job that you enjoy, like I've just mentioned, negativism, cynicism, and of course, with time, you will not really enjoy what you always enjoyed. When we look at our history, we have to appreciate that we've come a long way from the time of the colonial era, which I don't want to delve in. But most importantly, my focus will be the post-colonial era. And I have to say, for sure, with a lot of confidence, the mental health crisis has been here longer than we thought it has been. Before COVID-19, we can appreciate that for decades, senior practitioners were actively engaged in different programs in the community. And if you allow me to just go back, because we cannot forget where we've come from as professionals who handheld us. There are quite many senior psychiatrists and psychologists, starting with the likes of Dr. Raymond Rango, the likes of Dr. Max Konji, the likes of Dr. Frederick Witty, the likes of Dr. Pius Kigamwa, the likes of Dr. Sobi Muhindi, the late, the likes of Dr. Sakala, the late, who was my lecturer in the university. These are people who have actually worked so hard to get us to where we are. And by 2018, and personally, this is my opinion, I think has driven this particular conversation of fighting stigma and discrimination is the Gen Z. They have done a fantastic job. And of course, as I will explain in my presentation, you will be able to be convinced, hopefully, that sure, we need such a program. called SDP. When we look back in 2018, we had adequate time as clinicians. We'd actually meet weekly, sometimes even twice a week. You meet on the weekday, and sometimes you decide to have a social in a group, maybe at a coffee house, maybe at the park. And during these supervisions, we would discuss clinical matters, personal development. Some of us would say, I want to get to masters, I want to do another career, I want to get married, I want to start a family. And aspirations about the future, specifically in this field. What stood out was a peculiar trend in practice. Amongst ourselves, we were able to appreciate that Kenyans in diaspora, specifically the UK, would actually really request us to have sessions online. The reason? When the physician would refer someone for therapy, they would be told, unfortunately, you have to wait up to 3 to 4 months before you see a therapist. Option number 2, call your relative at home, you say hi to them. Long stories, of course, Africans, we love long stories, and then eventually you tell them, you know what, I need a therapist. And they will actually go to the internet, identify a therapist, and the relative would actually tell them, why don't you try this therapist? Already in 2018, we have started seeing a pattern. Young people, of course, would come to us, self-diagnosed, say, I think I have anxiety. I think I have a panic attack. I think I have depression. I think I have PTSD. This gave us an opportunity to have meaningful conversations with these young people to first ensure that for sure what they were saying is the case. And we went through screening and assessment, and many a times we'd confirm the same. Though the same, we would also confirm that maybe they were going through a difficult time and they needed maybe some kind of life skills to cope, or perhaps some skills in CBT like cognitive restructuring, thought-stopping techniques to be able to cope with whatever mental health they were going through. And of course, the field for sure was, as I've demonstrated, quickly evolving as a result of technology. And for sure, we often, during our supervisions, ask ourselves if we were ready for the inevitable wave that was coming our way. Of course, I've talked about the use of internet and how, for sure, through the website and so forth, we're able to interact with people within Kenya and out of Kenya. And by the time COVID-19 case was first announced in March 2020, the request for therapy services were already on an upward trajectory. Those of us who are in active practice had started noticing a pattern in terms of we are getting overwhelmed. We were exposed to the risk of burnout, really. Supervision, of course, started becoming a little bit tricky, and this for sure created a major gap in monitoring each other's work, holding each other accountable, and definitely the regular peer supervision. And during that time, we could hardly meet because of the nature of work that we were engaged in. And of course, presently, all over the world, there is the need to have more therapists. And many are taking up psychology in our country and all over the world. Surprisingly, when I was preparing for this webinar, I noticed there was a similar pattern in the 60s and 70s in the United States of America, when many students enrolled in psychology as a major. And to quote the author who wrote in the New York Times, the title of the article was, "For some reason, psychology is popular." And this was an article that was written in 1975 by Larry Van Dane. And he said a decade ago, at least 17,000 degrees were issued to psychology students. And they had actually taken that as a major. Psychology was a major in the course that they did. And for sure, academicians and other people in the field criticized and asked, I mean, where are these 17,000 students going to go? Because there were no jobs for psychologists then. And of course, data from COVID-19 practitioners impact survey in 2022, that is according to APA, reported that 60% of psychologists had no opening for new clients. And over 40% had long waiting lists of up to 10, then 10 patients, or nearly 50% of the 2,295 psychologists agreed or strongly agreed in a questionnaire that they were burnt out. So you can tell already in 22 in America, you're seeing that. And of course, due to the COVID, this is a global phenomenon, even all over the world. And of course, as mentors, because over the years, we've gotten to an age and you're saying there's a gap, we need to mentor guys. We've been mentored, why don't we also mentor? And we envision that as students who are in practice, who are in research, that as mentees, we'll make sure that they are happy, they are scientifically rigorous, and perhaps continue working for us, under us for a long, long time. Let's be honest, we do develop an attachment with a mentee who you've actually handheld and after they're doing a fantastic job. But this is usually uncertain. They might at some point change their minds about their career, pursue further studies, or just to start their practice. I mean, will you view this as perhaps competition? Will you actually embrace this person and say, fantastic, why don't I work with you? Most of the times we are caught off guard when this happens. We are never sometimes prepared to let go. Especially in this day and age, where anyone you work with might say, okay, I've reached a point, I want to let go. Sometimes they can even give a 1 week notice. How do we recover from the loss? The question is, do we really ever recover? When we think about burnout, could it be that when we lose some of these people we mentor, we get to a space maybe then we might actually get burnt out, look back and see all the number of students you have mentored have left. But that doesn't have to be the case, for sure. And that is why, again, I'm convinced program like STP at a time like this will go a long way in making sure that we as mentors continue hand-holding young and also the old and everyone to be able to make sure that the high standards of our profession are maintained. Therefore, the Kenyan perspective, what is the problem in our country? For the past 3 years, many local newspapers have reported matters to do with stress and depression as the main reason for death amongst health workers. On February 8, 23rd, a press briefing by the Kenya Medical Practitioners Institution confirmed the same media reports and even gave statistics. Another study at the University of Aga Khan interviewed 4,000 nurses, midwives, and community health volunteers between 2021 and 2022. They were seeking to highlight the resilience of frontline workers in the 47 counties in our country. They established at least 1 in 4 of these health workers exhibited signs of depression. And we can see, I think this is clear, and I believe it's a global thing, that depression, anxiety, trauma, and so forth and so on are issues that have been in this space exacerbated. However, they've always been there. Of course, in our country, again, as we look at the perspective, we've had major milestones. I'd mentioned earlier about Generation Z, though I didn't mention about millennials, perhaps because I am in that bracket and I'd already told you my story. For sure, they have been on the forefront in the fight against stigma and discrimination. They are frank, honest, and bold. Perhaps similar to the baby boomers, if you look into history. A story for another day. They encourage the public, peers, and parents to seek help. We've seen that between 2018, 2019, 2020, before COVID, we witness parents being accompanied by their youngsters, or their youngsters calling in and say, I want to consult about my parent. And what is amazing is that over this period from 2020 to 2028, we've seen parents who come voluntarily, and in many instances, the results are fantastic, and we feel so encouraged. So there's been a great milestone in the job that we do in our country. Of course, there's a Counselors and Psychologists Board, which is now in the process of registering all psychologists in Kenya. And if you're in Kenya and you've not been registered, please take time and look into that. This is very good news for us professionals. For the past 20 years, from the time I was in school, we only had associations. For us to have a board in place, it is amazing, because for sure, our profession for once will be regulated. And my very good friends who I meet in corridors, in hospitals, other places, who used to tell me, Lambert, are you guys still practicing illegally? I am hopeful that in very few days from now, that will be a story that we will look back and say, no, I am now practicing legally, and I am proud to be associated with the board. And of course, the task force, the mental health task force, which was established in 2019, led by Dr. Frank Jenga, did recommend that the government declares mental health a national emergency of epidemic proportion. And for sure, what this would have done, and I'm hopeful that this can happen, is that the less than 2% that is allocated to mental health, things will change. They'll allocate, government will be able to allocate more funds to make sure that we are able to actually fight this particular problem that is facing us Kenyans and the globe. And of course, recently, the Social Health Insurance Bill, which was launched on October 23rd, will extend health insurance to all Kenyans, with the government subsidizing coverage for the poor. I do believe within this particular bill, there is the primary care bill, and I am certain as we continue, the board continues registering mental health professionals, very soon, I do believe we will get into a space where psychologists will have a clear scheme of service, and psychologists will actually be involved in primary care, where we will definitely be able to assist in picking some of the mental health challenges from a very early stage before it gets to a point where it becomes unmanageable. And of course, when we come closer to where we work, our clinical setups, we must say that as clinicians, it is always important to take time and do some stock taking. And the survey that we conducted at our facility between 2020 to date has shown that for sure physical and mental health professionals are seeking therapy, and these numbers are going up. We need to think about that. Why is that? Could it be associated to the nature of the space that we are in right now? I honestly can't give an answer at this point. But again, it could also be a sign of good news, because we are now as professionals appreciating that we help us. We not only need to help ourselves, but we have the capacity and the power and the insight to be able to seek help without fear of being stigmatized. And of course, we have become too busy to the point we hardly have time to meet for supervision, like I said earlier. And this has dwindled over time. But fortunately, through the clinical supervision sessions by Chiromo Group of Hospitals called the Grand Round, we had some kind of reprieve as clinicians because through this online weekly, every fortnight actually, it's not weekly, sessions, we at least were able as colleagues to feel at home. So that program has also helped us in our STP program, because those who are in the STP program engage in those every 2 weeks supervision sessions where they learn a great deal. And perhaps that is why at this point I would say maybe it's time for us to rethink how we mentor, supervise, and how we support each other. Things have changed. We're in a space of opportunity whereby, because of technology, at least supervision did not come to a certain halt, because we could actually interact with our colleagues from anywhere without necessarily meeting face to face. But having said that, I think that personal touch, that face-to-face kind of interaction is extremely important. And that is why, as CBT Kenya, we thought through the skills transfer program based on actually our experience, having interacted with senior mentors who have been in the field for many, many years. As I mentioned earlier, they actually came to help us become proper clinicians. And of course, like I mentioned, the youngsters, the Gen Zs, of course, have really helped us in ensuring that we get to where we are today. And of course, the goal of this program, sorry, excuse me. Okay. Apologies. Okay, the goal of the program is to transfer, sorry, technology. The goal of the program is to transfer skills you can learn in one context and transfer them to another domain. And allow me to go back because of the technology. Our program, like I said earlier, was inspired by senior mentors, seasoned practitioners, who, a number of them are psychologists and psychiatrists, the Generation Z that I mentioned, and most importantly, the clients we see and interact with. The first cohort of this program was started in October 2021. So right now we can say we are actually 1 year old. The goal of the program is to transfer skills you can learn in one context and transfer to other domains of life. So very simple. Within the space, one of the most important things is observation. And psychology focuses on observation. We are able to actually allow people we mentor, students, psychologists that we mentor, and other clinicians to actually just watch us. And as a result, they're able to transfer that. Learning and transferring of life skill is viewed as an interconnected and developmental process at any stage. So they can learn at any stage. And this program can even go to the lowest level. And that is why our program is anchored in what we call the third wave cognitive behavioral approaches therapy. And of course, when we talk about third wave, we delve into matters to do with concepts like mindfulness, acceptance commitment therapy, cognitive diffusion, most importantly, values and psychological flexibility, amongst others. Therefore, question is, who benefits or who can benefit from STP? Students, psychologists that want to come back to the field. Of course, we know there are people who are perhaps thinking, okay, because of what you're talking about, we might want to help you. You're being called upon to come back and see what difference you can make as a clinician. Then the program is able to help you. Those that want to start private practice, within this program, you'll find that there are people who will come, and we do not have a problem with helping you understand how a practice is run from the point of interaction with a client, either through a phone call, either through a word of mouth, either through the internet. We are able to explain to you how then you get to the administrative space, matters to do with maybe billing and payment, accounting, understanding how a practice is run and what you might want to do. Maybe asking yourself, do you want to put your clients, maybe if you have a team, on a scale, payment scale, a payment plan, how to get into the space of insurance, how that works, the opportunities, the challenges when it comes to insurance, whether you want to go that direction or not. We are able to actually take you through the whole 8 years so that you're able to really decide whether you are ready to do so. And if not, we still work with you. And if you want to, we still work with you. Those that want to learn skills to avert burnout. And of course, like I've said, our program is based on CBT principles, the third wave, and the same way we interact with our clients is the same way we will interact with the mentors who are in the program. Though, as we continue the presentation, I'll explain what might be a little bit different. Remember, the idea here is skill transfer, and we've come to appreciate, and that's why I said we learned and we appreciate, we were inspired by our clients. We realize even in clinical practice that many young people sometimes will assess might not necessarily have a mental health issue. They just have challenges with life skills, coping skills, perhaps communication skills. They are not able to assert themselves. They're not able to say what they are thinking and so forth, and they keep to themselves. They are passive, perhaps passive aggressive. And as a matter of fact, you find that this is something that has been there for years. Then by the time you interact with someone like that, they seem actually depressed. And when you actually take them through a questionnaire, for example, like the cognitive distortion or cognitive error questionnaire, then you find for sure the challenge is their way of thinking, their perception. So then we are able to teach skills, and sometimes, many a times, by the third or fourth session, we notice very interesting changes in someone's functioning. And this is the kind of unfolding that we engage in. Those that want to learn, those that need a network of competent behavioral and substance use professionals who speak the same language. We have associations within, we have colleagues within, we have young people who are venturing into this profession. We handhold them, but most importantly, we take our time. And of course, the other people who can be helped are influencers. They are big. They are here with us. They can be used as advocates. Those people who are in the informal sector called Juakali, who might also definitely find themselves in situations where they might need a few skills here and there. Managers that are always interacting with their colleagues and perhaps might need some skills or a toolkit of skills from this third wave approach to be able to quickly identify when they need to consider an intervention like referral, or perhaps just help them by using or recommending some of the skills. And of course, these are the steps of how STP works. You go through the application process. Let me just use this slide. So we first have the first step. And of course, our program is free for students, bachelor psychology, and all the guys I've mentioned. But at the moment, we are focusing on psychologists. The first step is online application. You apply online. Then you go through the interview, and the interview we meet you as a team of senior psychologists. Then there's a level that we follow so that we have a pyramid of some sorts for professionals from the lowest to the highest level. Then you go through orientation. And of course, during that time, there's a lot of anxiety. Will I be accepted? Will I be rejected? We allow everyone as long as you have a degree in psychology. And of course, subsequent to that, we always ensure that we have a ceremony where we introduce them to hand-holding. Then there's a curriculum, then the game changer. You have 3 months to learn the ropes, to decide whether this program is fit or not. After that, you can continue until 1 year. And of course, there's a step of mastering the skills, observing the supervisor, peer support, self-care techniques, exploring the stages that work, exploration stages, what stage you explore and you start really finding your way, and you decide to start learning whether this works. Does this work for me or not? Am I good in this? Am I good in that? Maybe I want to venture into research, or maybe I want to specifically focus on supporting people who have a specific condition, or maybe no, I don't want to venture into clinical stuff. I just want to really focus on really sensitization and being an advocate and so forth. Just sitting and really engaging in personal therapy is too challenging for me. How many times a week can I work? You are able to start really gauging yourself. Am I a marathon runner? Am I a sprinter? Am I a person who needs to just walk? And walking would be, maybe you say, I'll be seeing clients twice a week. Book for me. Okay, sprinter, I'll be seeing clients almost every day, and then now I can take a break for 3 days to recover. Like that. And of course, our sessions for the longest used to be once a week. Plus, of course, like I mentioned, the other week, alternate week, we'll attend the grand round to ensure that they're able to sharpen our clinical skills. But now where we've reached, we are doing it twice a week. So that means it's almost, we are basically doing it 3 times a week. But of course, it has been there for a year. So it is evolving, and hopefully it will continue growing. And hopefully we'll find either that is what works, or maybe we need to reduce the number of interactions. And of course, I've mentioned the duration, and that basically is the SDP program. It's an ongoing program. For today, I won't go into the details. I won't tell you the number of people we're interacting with. This would be a story that I'll give you hopefully in a different forum. And of course, at this point, I'd like to suggest that we collaborate. Of course, like I mentioned with the grand round, we've collaborated, and it's important for us to commit to working together, to be able to build the capacity, to be able to make sure that we actually manage burnout. Because the minute we start identifying how burnout builds up on us individually, because we are not the same, one shoe size cannot fit all. Then when we are able to individually identify that, then you are able to actually avoid getting into depression, getting into a space where you start having psychosocial issues, you start having familial problems, you get into substance, to self-medicate. And fortunately, as we all know as addiction experts, this is a progressive issue, and it might get into a not so very good space. Sensitization, let us educate the public and ourselves about the evidence-based approaches that are available, which we can actually use to create safe spaces where professionals can be vulnerable. After all, we are not superhuman. The work we do dictates that we must have an outlet. Anything that has an inlet has to have an outlet. So if we are practicing without really getting that space, it is a matter of time. I gave my story. It took me so many years, almost 10 years, to get to the space of burnout. And I almost stopped practicing. Let's teach and handhold influencers, physical health professionals, jua kali guys, the informal sector, business owners, pastors, imams, everyone in the community, because we're in this space where we are focusing on ensuring that we go to the community, roll up our sleeves, move away from the office, and empower the people in the community. And of course, research. Is it possible to work with researchers to crowdfund resources to establish programs as therapists? Can we build a global network? I believe it's possible. Senior and upcoming mentors to ensure the principle and standards of our profession is maintained. Of course, at this point, I must say, at CBT Kenya, we are well aware that you alone can do it, but you can't do it alone. Thank you very much.
Thank you very much for that, Lambert. I noted that we were having a few issues with the audio. I don't know if it would be clearer if you could turn off your camera, then the connection or the audio flow might be smoother that way.
Okay. Just a minute. Like I said earlier, I need to find my way. Okay, you could continue unless it's really bad.
Okay, we can carry on.
Okay, it is.
All right, thanks, Lambert. Thank you again for the presentation. Just waiting to see if there are any questions coming in from the attendees that you might be able to respond to or clarify. Okay, it doesn't seem, right. There's a question here, Lambert, there's a question from Alexi, and they're asking, how do you define health psychology, clinical psychology as academic subjects? Let me just say that again. How do you define health psychology and clinical psychology as the academic subjects?
Okay. All right, thank you for that question. Of course, the truth of the matter is that there are about 50 branches of psychology, and if you choose any of these branches, some of them are not provided in our country, then you must go through the process of school, being in class. And of course, at some point, then you are expected to, because this is a practical course, you're expected now to get into the clinical space. So when we talk about health psychology, clinical psychology, I think for the longest time I only knew about clinical psychology, and then there came health psychology. I think the names are very similar, though I think health will focus maybe more on matters to do with public health. It might go venture deeper into the hospital setup, both physical and mental, but clinical specifically focuses on mental health issues, and that's why many clinicians work in hand in hand with psychiatrists and of course with other professionals. So as an academic subject, I think I've mentioned all the subjects you have to go through school, and then subsequent to that, it's important then to be able to transfer the skills you've learned in class into practical meaningful skills that can help the clients that you see.
Thank you, Lambert. We have another question from Erica Cyberas, and she's asking, how can we incorporate the STP program at work, especially the big brother or big sister step?
That's an excellent question, and I think it's very timely, especially when we talk about matters to do with the employee assistance program. I do believe that through this STP program, we can be able to actually very easily transfer skills in such a setup where you are able to actually not only train the managers and the people who work in a work setting, but you're able to actually identify ways of helping them even out of away from work. And I think such a system where you empower the professionals or perhaps identify paraprofessionals, almost like what you might want to do when you have someone you train in some basic skills to identify, okay, maybe this person is having a certain attack, asthma attack, whatever it is, it needs first aid and so forth and so on. And if you're able to have quite a number of those guys, then I do believe that it can actually be easily incorporated in such a work setting. So that is very possible. And like I said, it is this process, STP, is based on the tenets of CBT, which are evidence-based, and skills people are able to learn. And I've said over the years, we've seen clinically many times you find that one might present as if they have a mental health issue, and after screening and assessment, you realize it's the psychosocial stressors, most importantly, the ones that come from because we spend a lot of time at work and in school. So this can be easily transferred within the work setup, and we don't have to have a clinician who's always there. One belief I've always had is the matter of school counselors. I've always fought with my friends who are school counselors, and because when we're in school, we would have challenges because you'd be like, I need to go and see you need to go and see the school counselor. Like, no, but the school counselor goes to the staff room. What about if they tell their colleagues everything that we discussed? So similar to that, there are systems which I think can run independent, just like in at the place of work, and we can be able to collaborate in that way to be able to empower people at the place of work. Before then, eventually they have, because there are times when it's inevitable that for sure one needs further intervention in a clinical setup. And that's why as STP, we've said it's time for us to move away from the clinics and go into the environment to be able to add value within that setting. Thank you, Erica.
Sorry, thank you, Lambert. Thank you for that response. Two questions from Jennifer Kaditz. The first one is, how do we get to join CBT Kenya? And second is this program for students or practitioners who are already in the area of addiction counseling?
This program is for both students. Okay, it's for behavioral professionals, so it's both people in the substance space and the behavioral space. Like I've said, we don't only have students who are young in the profession, we also have professionals much older professionals, maybe in their 40s, 50s, who maybe have retired and they want to actually get back in the profession. Of course, the minimum requirement is at least you have to have be a psychologist. However, like I've said, I won't say much about some of the nitty-gritties, hinting to those are some of the ways, directions that we might want to start thinking about, apart from helping the helpers alone. going by Erica's question, this is a very good program system that can equip even people who are not professionals with skills that they can be able to process issues that they're going through, identify the toolkit that they need to use. Is it that they need to use what we call the 3 C's, where you catch automatic negative thoughts, ask your questions like, are these thoughts helpful? They make me feel better. Are they solving the problem that is at hand? And then you are able to structure that thinking with more practical, realistic, or more use kinder words to ask, to kind of reassure yourself that you're on the right path. Because, of course, the world we live in, you're always having a lot of self-doubt. And most importantly, like you said, we all need to actually re-evaluate what are my values. Sometimes we don't even know what our values are, and so forth and so on. So, yes, it's open to everyone. You can get in touch with CBT. We are on the internet, www.cbtkenya.org. You can check out our website. Yeah, everything is there. You can drop us an email. You can drop me an email, lambert@cbtkenya.org, and etc. And we'll be more than pleased to interact with you and engage you further.
Thank you, Lambert. Another couple of questions from Sean. In your opinion, would you say there is enough research on who helps the helper in Kenya? And additionally, are the measurement tools that are used adequate?
Maybe, okay, maybe I can answer the first one. To measurement tools, maybe it depends in what the measurement tools are usually standard, and they're the ones that recommended by the WHO. We also use the manual, the diagnostic manual, to engage some as tools. I mean, screening tool, and of course there are also tools that we use to help you in the process of therapy, and also perhaps even the skills transfer. When it comes to research, I do believe that partly the reason why we are having this conversation is exactly that. I know Professor Gashuga, who is senior and who is the chairperson of Kenya Counselors and Psychological Association, and has done extensive research. She wrote a thesis on the same, and she's written a book. So I think there is a little bit of literature, but we need to do more, because the truth of the matter is we are living in a world where people are very knowledgeable. What we need is solutions to some of this information that we take in. And we have a lot of information, but how do we then convert this information into meaningful data that can help us in our lives? That is actually the question that we have to think about, look for ways that are also culturally appropriate, because sometimes you might look at some skills, some recommendation, like culturally that might not really fit. Then what you do? Those are the questions that we are thinking at STP, and perhaps many other programs that are similar, come up with solutions, or that based on processes may help moving forward.
Thank you, Lambert. We have another question. What kind of health promotion programs can you suggest for the youth in Kenya?
Okay, I mean, the youth are very active. The youth are also really going through a lot, specifically when it comes to the economic space we are in, lack of employment, etc., etc. And there are many programs that we can think about when it comes to youth promotion. For example, when it comes to what has to do with the profession that we are in, really there are many ways of engaging the youth in what we call machinery in the community. And we can think of sensitization programs, which have been going on for a very long time. Okay, we can think of programs where we are able to actually not only educate them, but help them really promote the idea of one, there are synthetic drugs, for example, in society, and how do we, within the community, within the churches, within this, the CBOs, just really have conversations, because young people want the face-to-face conversations, and by so doing, and you will have experts who have not only talks, but are able to actually engage them in meaningful skills that they can convert or use in their lives. Because we are doing very well, like I said, the promotions are very many, activating them all over. NACADA is doing a fantastic job on the same, ISSUP, PRAC. These are all organizations that are in Kenya that are really focusing on the health promotion. But I do believe that we need to go a step further. And that is why we're having this conversation. So, yeah.
Thank you. Thank you very much, Lambert. That's all the time we have for the questions, but as Lambert availed his contact details, and the presentation will be availed once more, a reminder, on the ISSUP website. Thank you very much, Lambert, for your very comprehensive presentation and the responses to the questions that were put up. We also want to thank ISSUP Global for hosting us, and the technical team behind the scenes whose support have made this webinar possible. Thank you to all of you who also participated by attending, and we encourage you to look for more ISSUP webinars in future. We encourage those of you who are here and may not have joined ISSUP so far to do so via issup.net. Or for those of us who are in Kenya, you can send an email to secretary@isuppkenya.or.ke. secretary@isuppkenya.or.ke. All lower caps, or lowercase letters. The presentation and the recording will be available in a day or two on the ISSUP website. Certificates of attendance will also be issued through the email you used to register. Once more, thank you all for attending and your participation. We wish you all a good day, good evening, and good night. Thank you.